on that note, because we've been talking about multimodal approaches, and I think that's an important aspect. There's a burden on instigating treatments and cost. So regarding multimodal OA management, what combination of modalities would you prioritize, Bryan?
Yeah, so for me, for dogs, I think primarily about weight management. I think about exercise, things that I can do, low impact exercises, things that I can do to maintain and build muscle mass, because the muscles are supportive structures around those osteoarthritic joints. I think about potentially supplements, things like that we talked about, the polysulfated glycosaminoglycans, things like that. And then our nonsteroidals as being really the kind of foundation as far as a drug therapy or pharmacologic, the nonsteroidals.
And let me move to cats. Margaret, how would that differ, or would that be the same for cats, in your opinion?
Many parts of it are the same. So the weight management, obviously for dogs or for cats, it's critical to control the pain. But I think about it the way that I approach many behavior issues, which is that the medication by itself can't do that much. You also have to have the changes to the household and accessibility, the exercise, the diet changes, and that the medication facilitates those. So you use the medication to help get those secondary pieces in place, and then you can start to look at dose reduction. Can you take that down now that we've got these other things going? If you can't, then you stay on longer or you stay on a lower dose. But that control of pain is critical to bringing those other therapies in.
And then, Mark, you mentioned the adjunctive drugs earlier on. So I think there's consensus here in terms of the basic approach. When would you start to bring in those adjunctive drugs?
Well, this is easy. That's like a slow hanging curveball across the plate.
Okay.
Because we have two sets of guidelines that were produced by industry experts. One in North America, the other one was global. So that's the AHA AFP Pain Management Guidelines 2015, and right about the exact same time was the World Small Animal Veterinary Association, its Global Pain Council Guidelines Recognition, Assessment, Management of Pain in Animals. So when both of these task forces looked at the totality of evidence in veterinary medicine, the five modalities that rose to the top very clearly: weight optimization, NSAIDs, arguably gripiprin now, the polysulfated glycosaminoglycan, EPA-rich diets, and therapeutic exercise. Those were the five. And so until those have been buttoned up, I'm not going to necessarily turn to much of anything else, right? And then I may go quickly to those other things, but those things have to be under my belt before I go to gabapentin or before I go to therapeutic laser or something like that.
So you're really relying on those five main modalities before considering.
Yeah, I think I think that's where the evidence is, right? If there was better evidence for gabapentin, maybe we put that up there. And the same thing with even acupuncture. It's not that you can't incorporate client values into that. If they don't like the pharmacology side and they want to go ahead with acupuncture, fine. We do acupuncture practice. We have laser in our practice. I'm just saying that when it comes to triaging, where to focus the veterinarian teams, their time and energy, and the client's resources, it has to be those five things first. Now, pretty quickly, we will go some of these adjunct pain modifying medications if we're not satisfied with that. And if we're seeing a pretty debilitated patient, I may go ahead and throw that into the mix out of the gate as well. Gabapentin would be probably my top choice, and amantadine may be right up there, particularly if there's any kind of neurologic comorbidity with it.
Now, Mark, there's one drug you haven't mentioned, which I've heard you talk about in the past, and that's Tramadol.
Oh, you've heard me talk about that in the
I
past?
have. Do you think, is Tramadol something we can rely on for an analgesic effect in these sorts of patients?
No. The reason is because both on a pharmacokinetic basis, dogs simply, number one, do not make the opioid metabolite that is so common in people, and that's why it's a scheduled drug now. So A, they make negligible amounts of that, and so that's just some mythology that needs to be busted right here, right now. Number two, the overall bioavailability is very poor compared to people. Low plasma levels, if you give it sequentially over time, those plasma levels disappear. It's undetectable in some dogs. So particularly for OA, to give it for an extended period of time, we should have really no expectation that it has any kind of significant pain modifying effect. And I would caution that when people say, yeah, but I dispense it and my clients say it's working and I think it's working, well, we're right back to that very first moment we had here about that caregiver placebo effect. Well, so does nothing work about 50% of the time. Because you could give placebo and in cats you could burn incense and they would look like they're feeling better because it's 90% caregiver placebo effect there. So no, Tramadol orally, it's not that it can't work because the parenteral version, there's some data to support that it does. We don't have that here in the US, so we're talking about oral Tramadol in dogs. There should be no expectation of any clinical efficacy in OA really. Cats is a different story.
I was just going to ask about cats.
Because there's both pharmacokinetic and clinical data to support its pain modifying effect, and they do make that opioid metabolite, and it has nice plasma levels and so on and so on.
But I think on a practical basis then...
Yeah, try to get it into a cat.
Exactly.
That is the key. That is the key.
Which I think is something, we haven't touched on this, the compliance. It's very easy for us as veterinarians to make a diagnosis, although I think we struggle in making an early diagnosis of OA, but we make a diagnosis and we write a bunch of scripts, but then the owner has to go home and give these medications.
Yes.
Do you want to talk a little bit about
Sure.
how easy, difficult that is, how naive we are?
How naive we are. I mean, it depends certainly on the cat, and it depends on the owner, but it also depends on the medication. So is it bitter? Is it bulky? I mean, how difficult is it to get in? I think that there are some wonderful veterinarians making recommendations and watching owners give pills so that they really know, so that you're not just saying, here you go, here's some metronidazole, go home with that. But watching owners give the medication and making sure that they feel comfortable giving it, and then thinking about what the alternatives are for giving it. But I think that there's a big issue of compliance when it's difficult to get, but it's also can be really damaging to the relationship. So if you see one owner coming and the cat goes hiding under the bed, that really decreases both the human-animal bond and compliance dramatically. So I think that we have to think about the medications that are tolerated for administration, some of the ones that may taste better that they can give, or when we think about these ones that are on the horizon that may be injectable, that will be much easier for owners and for cats.
Yeah. And I think it's important to mention, especially with cats, the difficulty of medicating cats. And there may be a good role for Tramadol in OA in cats if it was palatable, but I think we can't finish this discussion without saying that what a lot of people then do is have it compounded or turned into a transdermal gel, and assuming that that's going to work. And if we look at nearly every drug that has been effective given, by injection or orally, that then got compounded as a transdermal gel or some other thing, very, very few, maybe one out of all those drugs has ever actually been proven to be efficacious. But a lot of people, just to get around the issue, just have the transdermal, products made, and there's almost no data to support their use.